Good morning. Welcome to the first episode of the premiere episode of my podcast, Hello to Marek. In this series, we will invite outstanding personalities from the beauty industry, experts, hairdressing industry, or medical industry. And if you're an expert in your field and you have something interesting to say, write to me. And today we have our first expert, Marcin Piwecki, z Fundacji Alopecia.pl. Good morning, Marcin. Welcome.
Good morning to all listeners.
Great. Thank you so much for accepting the invitation. I'm very happy and very honored because this is the first premiere episode. Tell us more about yourself and the foundation.
Well, let's start with the foundation, which is the Foundation for Education and Medical Alopecia. And our website address is actually Alopecia.pl, and this is an entity that I set up a few years ago. On the other hand, we actually started to work more intensively a few months ago. Right now, the basic formula. Our job is simply education, as the name suggests. And we do this by hosting webinars on topics specifically related to hair loss. So far, we've managed to run 3 webinars for parents of children affected by plaque baldness. And there I invite you. And I'm the expert this time, and I'm talking about alopecia, which is a very complex, insidious, somewhat unpredictable disease. I know that. We're going to talk a little bit more about that in a moment. So there's also like a little bit of advice from the trichological side. The second expert invited is a psychotherapist who talks about how you can help a child deal with such problems, and also how parents themselves should be able to deal with such a very difficult emotionally situation when we see that someone closest to us is actually unfairly, unjustifiably affected by a material problem. And the third invited expert is a person who she keeps herself fully informed on clinical trials and the latest psoriatic medications. In addition, we've already done a few webinars for young men who are also affected by androgenic baldness. And there are many, many myths out there as well. There's a lot of news to unravel. Second, in addition to the foundation, I co-own and cooperate a medical clinic called Perfect Clinic. We have been operating in Katowice since 2016. Well, I guess I can say that we are probably one of the best clinics in Poland dealing with androgenic hair removal. We specialize in this and try to make the latest, the best researched e-therapy, androgenic baldness, we just had available straightforward. You asked me a question.
Indeed, she did. Marcin tomorrow, also from his work on micropigmentation, that's alopecia hair loss. Where does that come from? Tell us, Bo. And he says there are several types of alopecia. I would also like to know about my work in micropigmentation. Expand the topic a little bit.
Yeah, it's actually worth a little tidying up, because very often we use these shortcuts of thought that can actually lead us somewhere on the Manoka. Medicine categorizes this field by initially separating types of baldness and hair issues. For now, let's maintain a broad and general perspective, focusing on non-scarring and scarring types. Thankfully, scarring issues are statistically quite infrequent. These are fractions of the percentage of the population that are affected by individual types of baldness, scar baldness, or scar baldness you have that are not cool. Is that they are irreversible, that there is still the voice just fading on the skin instead of the mouth of the hair follicle we see growing more and more scar So that's like very uncool things. Unfortunately, they affect women more often than men, and that's just what dermatologists who specialize in these issues should be doing. Trichological ones are always enough, as if difficult therapies are mainly based on pharmacotherapy, partly some kind of therapeutic therapy. As I said, fortunately, it affects a small group of the population. And we have the whole next group, which is baldness, right? Potentially reversible. We have some kind of instrument here that we can use quite effectively. And in the context of those non-scar baldness, which we can mention first, let's talk about baldness, which is called anagen baldness. I don't think there's any reason or place here to tell you exactly what the name means and so on and so forth. We can simplify it. These are just chemotherapy situations, right? We take very strong drugs. Our body, among other things, reacts to it in this way that all our hair falls out rapidly. But the good news is that exactly that same existence. The hair grows back. Sometimes it grows a little different, for example, thinner or a little different color, or the hair is pretty straight. It gets a little more curly, but basically it's very unpleasant. But it takes a certain amount of time, and then we go back to normal appearance, normal function. The second type of baldness, and we'll probably talk about it a little bit more here, is actually alopecia areata, patch baldness, in its most common form, just alopecia areata, or A, and quite often this abbreviation is used, or more aggressive, covering a larger part of the surface. Hairy scalp and eyebrows and eyelashes, or the whole body. Alopecia universalism, alopecia totalitarianism. Here also, fortunately, we are dealing with some very large part of the population, because usually the statistics will say that plaque pattern baldness affects about 2% of the population. Unfortunately, it most often occurs in children and adolescents. The second one of those discards of the likelihood of developing a pattern baldness is around the age of 30. And then we have two absolutely the most common ones, that is kind of like me too, although you can do something about it, like you can see from me. EE stands for androgenetic alopecia EE, which affects the vast majority of men. So the simplest statistic is 20% of 20-year-olds, 30% of 30-year-olds, 40% of 40-year-olds, and so on and so on. Also, about a third of women suffer from androgenetic baldness. And the second, the group is an umbrella term, you can say, which is telogen baldness. Baldness, which is supposed to be reversible. But here, the set of possible causes is much broader, and sometimes we have a really serious problem identifying that cause, finding it. What are we talking about here? So these are rapid hormonal changes. An absolutely textbook example of such a change would be when a woman is pregnant. The thing about pregnancy is that you have very beautiful hair that's associated with high estrogen levels, but then you have to give birth. The hormonal economy changes by 180 degrees, and at this point, after a few dozen weeks, the hair loss occurs. After 400,000, 600 hairs a day, a woman like that can lose fill. Fortunately, it should fill on its own after 6 or 8 months. Return to normal. So this is one example of telogen baldness. Another reason could be taking various kinds of medications that induce non-telogen hair loss. Be the situation when we have some illness especially with a high fever here. Well, we're after the COVID epidemic, but it was quite characteristic, so it was even called COVID hair loss or COVID baldness. We still have situations that occur. Anesthesia, especially general anesthesia. So after some surgery, we have this kind of hair loss again. I point out here that the mechanism of telegenic baldness is that this hair loss does not occur immediately after the trigger, but unfortunately for the ease of identification, it happens after 3 months, sometimes a little bit.
You know well where it suddenly came from.
So not everyone remembers what they got 3 weeks and 3 months ago, or did they have a fever, or did they have a fever to complete this catalog of potential causes. These are all kinds of hormonal problems, thyroid problems, and stress. Both stress, such as individual stress, with and related to some one specific event. What about chronic stress and telogen hair loss? This is something we're going to observe, seeing about her actually here in the shower. So you comb, and suddenly she's watching, not 80, 100,
Hair bow.
like this.
Women often say that all of a sudden, so much hair, but after all, we lose hair every day. There's some kind of hair loss norm out there. Absolutely, you should be concerned there.
It's normal for us to lose a few dozen hairs. Even 100 or 120 hairs will be considered normal. It depends on how much of that hair you just have on your head. On the other hand, with this intense baldness, it's legion. Well, we're actually talking about those hairs that can fall out every day. 400, 600, 800, even 1,000, so that's it. Things if this situation lasts for a few dozen days, a few weeks, then we see absolutely noticeable changes, just like this pony, which is sometimes hard to catch. All of a sudden it becomes very, very shady, so this is especially visible as we just have some longer hair. So this one we weave a braid or something like that, then this volume of hair changing.
It seems very like that. You don't know, suddenly they're not there.
Yeah. Androgenetic alopecia, well, it's slow, it's really basic. The symptom here is not so much hair falling out as this hair darkening. Initially, the hair becomes thinner and shorter. At some point, we get to a point where this hair follicle is actually becoming empty. And this empty hair follicle functions for a few months, and from there, also through androgenetic alopecia, we'll see a decrease in hair density, but it's just a decrease in hair density. And we don't even notice the moment that more hair is falling out every day. Also, these are sometimes quite detective situations when the patient comes to us and talks. This is a picture of me from a year ago. This is what I look like today. Why is this happening? And sometimes the answer is pretty easy to find. Men are less complicated. And sometimes you do. In order to gather extensive information, of course, you need a trichoscopy, which is working with a trichological camera, where we zoom in on this scalp, the openings of the hair follicles, and whether this hair is thick, thin, and so on and so forth. And if there is a need, then you have to reach even further. For example, the results of a blood test, or something like the ultimate instrument that you can reach here. It's just a biopsy, which means we take a few slices and from the scalp, but it's really like rare enough. EE related, for example, to the confirmation of these severe forms. As we were talking about the scarring, then it's worth confirming the diagnosis by biopsy.
Well, great. Very, very interesting to say that. The topic for me may be interesting is the wrong word in this case, but because I also meet with such cases very often, in the case of micropigmentation of the head or eyebrows, and here, for example, I recently had this young boy, he's 16 years old now, but he lost.
Can we show you?
I'll show you. Why don't we post a picture? Zoom in on the screen.
You can see it here.
She was young.
A person who is in this more severe form of pattern baldness, which means you can see that they have lost both eyebrows and eyelashes. So it's either alopecia totalness or alopecia universalism. Therefore, one must say that professionally done scalp micropigmentation is very well executed. Unfortunately, it is the only plausible solution here. Attempting hair transplants with such conditions would likely have a very minimal chance of success.
You also have to have somewhere to get it, so there must be enough materials of the recipient's case besides some artificial hair of some kind. Systems. We want to get into this, I don't know.
I mean, that's the area of the wig system and so on and so forth. I know it exists, I know these are cool solutions, but I'm definitely not an expert in this area, which also works, but we wouldn't recommend it. It's an artificial hair implant, yes.
This is it.
There are two manufacturers in the world who produce this kind of hair just out of plastic, but of course they have some antibacterial additives and so on and so on. But in the vast majority of cases, this creates quite serious problems with aftercare in this regard. Well, as I said, we as a clinic, we don't recommend these solutions, and we're certainly in the majority rather than in the minority.
Well, I think so too. I think first you have to think about not harming the future as well, because this is such a sensitive issue for the patient already, so I don't think we want to.
Is it even more so because of the possible complications associated with such a neglected situation of artificial hair implantation? Well, these are really pretty serious things with these irreversible changes on the surface of the skin. Let's leave the thread.
And how, for example, to prevent it at all, because sometimes patients come to me for micropigmentation of the head and say they don't know where all of a sudden all the hair came from, fallout. Are there any, well, I don't even know about the nature of the detox, or if there's something that we should pay attention to, maybe a better diet, less chemicals, or if there are some triggers that affect that something can suddenly happen in the body and beyond. Start the process.
Absolutely. Well, just so as to give actual practical advice, then we have to define ourselves here. What exactly are we talking about? Yes, because it will be a very different comment for a person with plaque baldness and a person with androgenic baldness. Let's start with the pattern baldness. It would be quite challenging to offer good advice, as I believe the only thing it would be, on the one hand, whatever is carried out. On the other hand, it would have a medical and scientific justification. It was to say, please don't stress yourself out like that, because what we know is that stress, severe stress, can induce pattern baldness. Yes, of course, there are certain, let's call them genetic predispositions, and that too, as if we have no influence. Thank you. So when it comes to baldness, there's really nothing else to say here. We don't have any supplements or any other kind of forms or formulas that you can actually recommend. So when it comes to telogen baldness, You can also say here, of course, don't be nervous. But you can also pay attention to having your blood tested fairly regularly, for example, to check that you have the right level of iron and ferritin. This is the thing here, like I'm directing this primarily at women, because they have much more problems with incorrect levels of iron and ferritin. But here some kind of supplementation might make sense, yeah. And then it's a little bit more complicated because we can talk about certain things like a little bit of prevention and a little bit of what I would call anti-aging.
I think this is such an interesting topic and timely, I guess, because it's worth taking care of yourself, I'll say, preventively.
It is already something absolutely normal and common for us that we take care of my teeth, for example, so that even if nothing hurts, nothing falls out, nothing hurts. Anyway, I go to the dentist every once in a while so he can take a closer look at something professionally and recommend some things for me. And obviously, as if we take care of our oral hygiene, we take care of our skin in the same way. We always take care of our face, neck, and hands first and foremost. So we take care of the right level of moisturization and so on, exactly like this. And now when it comes to hair, there are absolutely different kinds of actions that we can or should take here. And this is, first of all, proper care, which means that we use the right, well-chosen products for ourselves, such as shampoos. If someone uses shampoo, conditioner, and so on and so on, keep in mind that it's like the primary area of action of the shampoo is not really the hair, it's the scalp, and things happen here and there, and it's the skin that causes problems like dandruff, sebum, and so on and so on. Hair as such is basically a dead thing if we do something to it.
It's like fingernails, right?
Well, I guess it even kind of means okay, except that no.
Let's finish it.
That's the conclusion and final part. So what can we do with the hair? In fact, we can stick something on it, and we can cause physical, partly chemical, structural changes in it, very well defined by different kinds of action, high or low temperature. But in that exact sense, there's no way we can they nourish the hair so that nothing happens in the hair anymore, nothing circulates there. He is merely a lifeless part of our body.
So cold shampoos, yes. Basically, they should work more on the skin. That's how we're supposed to choose shampoo when it comes to skin, not...
Fruit undoubtedly is, and as if it were. I believe if brand A shampoo works well for you, then surely it will be suitable. Marek is intelligent and cool, so I'll choose the same shampoo as him.
He will definitely be present.
No, I strongly recommend avoiding that direction.
Everything always needs to be done individually.
Additionally, let's find a professional who does. And he'll look at our scalp with the appropriate tool, the trichological camera. I'll see what's there. He'll notice what may come as a surprise to many. Sometimes, for example, one part of my scalp is dry and the other part is overly oily. Sometimes you have to have two different treatments for the same head because different things are happening in different parts of this head. It's common that my head needs different care in summer and winter, depending on factors like wearing a hat and the weather being warm, cold, or damp.
Cellulite-free dry air, yes.
Thus, it's beneficial to have a professional that we meet periodically, not necessarily every 2 weeks, but more often than once a year. Every 2 weeks, but don't let it be once a year, to actually pick out some things. And also remember that since I'm in my 40s today, it's not necessarily going to be good for me the same remedies that I used 10 years ago. This is how this aging progresses, these different kinds of changes that occur on our scalp, in our hair dwellings, and as a consequence, these changes are evident in our hair's appearance.
So it was the prevention, yeah, or any other supplements. We know iron, ferritin, or something here. I don't know. I'm always thinking about heavy metals and food because unfortunately we live in times like this a little bit that chemistry is everywhere a lot, or something that needs to be paid more attention to here. Obviously, we don't want to cross somebody out there, some companies and so forth, but
I believe you need to exercise caution.
Because defending ourselves against it, like you're talking about heavy metal pollution, it's like, well, there's nothing we can do besides vote. The municipal and state level to introduce different kinds of so that they replace the stoves and so that our cars are less like jets and so on and so on. So here from this level of people, no, you can't individually build a barrier against the air.
I suppose you could read one too. Well, I don't know food labels and also choose more consciously yes or no.
Are there? Definitely when it comes to food, absolutely yes, we have it here. The hair is very demanding on this side, and as we already said about ferritin, iron is the second component that is worth highlighting. Our proteins.
To drugim składnikiem, który warto podkreślić, są białka.
Hair requires good quality, high quality protein. If someone has a diet that doesn't provide the right quantities and the right quality of protein, they're bound to have it in a fairly short time.
Problems. This is truly an entirely new experience for me.
Yeah, and also like collagen is coming up here, so like somebody, he likes supplementation, he this too, and collagen, for example, is worth thinking about here in the context of hair. To spit, on the other hand, the threat of supplements is for people in the industry as if it's an enduring mystery. Why is it commonly believed that you have a problem with hair, sips, and biotin?
Powszechnie uważa się, że masz problem z włosami, łykaj biotynę.
All the research actually credible shows one thing, that biotin is extremely important for hair growth for those who usually have a genetic deficiency in biotin absorption, which is extremely rare in nature. So is Phil really Phil? What is the minimum proportion of the population with such a diet as is characteristic of Poland? She will have biotin deficiencies due to this, as if supplementing biotin to an average Phil. There really isn't much good for a patient client.
Well, interesting.
But marketing-wise, biotin was digging into ours.
Well, I'm not looking because I don't think anything will help me at the moment, but I know that there are a lot of biotin products on the shelves and people read and talk about it. You have to be careful.
Unexpectedly, we discovered a very effective genetically engineered drug for men, combining a known form already for many years, one of the drugs, i.e. finasteride, the basic drug for men to settle androgenic, a new formula, also known drug, i.e. minoxidil, with the fact that recently more and more often minoxidil. It is for oral administration, so we had 1 milligram of finasteroids as recommended, 2.5 milligrams of minoxidil, as well as the most evidence-based medicine, and a third ingredient, biotin. Oh, I wish I could.
This marketing.
Yes.
Thank you.
So that's it.
Marketing combined.
Exactly. It's not going to make it any better or worse.
She hitched.
Exactly. Well, it's also cheap to make because of the why.
For good, then we have these supplements and some other therapies, which means someone is already starting to see that they have problems with hair loss. In addition to supplements, are there any other treatments? You say some drugs.
That's the current situation.
Going back to what we said a few minutes ago, so we called alopecia, we started talking about ferritin iron, stress in the context of telegenic baldness. Now we can sail into my favorite waters, androgenetic baldness. So, just like we said, over 95% of men who say they have hair problems are actually going to have genetic hairs, and about 25 to 30% of women have hair problems. It's also androgenetic alopecia. To make it a little more complicated, like women do, it often happens they have quite often at the same time the male and the androgenic ones. And we recently started to say to ourselves that this androgenic pattern baldness in women is such a silent killer because it's a process that happens slowly. Can we effectively stop it or even reverse it? But quite often it goes undiagnosed. Quite often we focus our attention on the fact that our hair is falling out, which means it's sedentary. And what if we're not trying to respond in the right way to the androgenic hair, which is all the time lingering and working? You asked what we could do here. We have a really wide range of different kinds of drugs from very effective pharmacotherapies. That's where we have to start, whether I'm a man or a woman. If I'm diagnosed with androgenetic alopecia, that's the first thing I should consider. I should consider a well-chosen medication. Can be very effective. It is relatively cheap because we are talking here about a cure that will cost more tens than 100 tens of gold per month. Unfortunately, as it happens with pharmacotherapy, we can be affected by all kinds of side effects as well as if we can manage them to some extent. Whereas here it's like there are no solutions that are objectively the best from every perspective, but like I said, certainly that's the first thing we should think about if there's any reason that we should. They tried to replace the medicine with supplements. All right, let's do it consciously. I already said that such a flagship drug for androgenic baldness is easy to use in men, a little more complicated in women. There is a finasteride no, and it has its more or less powerful substitute in the world of supplements. It is Palma sabaloa. So, or Sereno repens different under different names. It functions, but as if speaking in Polish palma palma itself half, so it also has an analogical mechanism of action with that. It doesn't have the side effects that we fear with finasteride, but at the same time, it's incomparably less effective. So if we're okay with this androgenetic baldness, we're not going to stop it. We're just going to slow it down to some degree. Then, okay, let's just this supplement. Then we have a whole world of different kinds of treatments, from treatments completely non-invasive. For example, there's this device called India. There we can just run a slightly warm electrode over our heads. We can put different kinds of helmets on our heads that will stimulate us with electric currents or light. Red? Why? Well, there are a few slightly less popular ones out there. Devices.
Technology is.
There's already another area which is minimally invasive therapy. Yes, no mesotherapy, however, we will make some kind of hole in the skin, or no needle free. It's almost that we won't do it, and we will already do it on the head. Here we also have a very wide range of different kinds of preparations. It could be preparations, let's call it factory, yes, which means artificial, conditionally prepared indeed. Why, under certain supervision, we have some kind of peptides, biometric peptides, we just have vitamin components. Is the protein component really 1,000 different types of mesotherapy, or is collagen in the form of tropocollagen also given? Another minimally invasive therapy worth mentioning is carboxytherapy. It involves a procedure where we feed carbon dioxide into tissues. It's medically pure carbon dioxide, and it's a therapy that works in so many different areas. This is used for anticellulite activity. This is when developing scars, because basically we're using such an effect that as we do in tissues. If we put carbon dioxide in, it's because our tissues think that we've worked so hard here, something like this must have happened. So the muscle fibers must have contracted intensely there. Well, we've been working on it, so we're getting extra supplies from the body, different kinds of nutrients, oxygen, and so on and so on. And that gives us cool consequences.
So it's kind of controlled, like controlled stimulation for self-regeneration?
Absolutely, yes. And the last of these minimally invasive therapies that I would like to point to is platelet-rich plasma, which is a procedure that seems to be very safe because we're giving ourselves processed fragments of our own blood. What does that give us? Very high level of safety because we know for sure that we won't be allergic to it. There won't be any allergic reactions with platelet-rich plasma. This is something that cannot be standardized. You have your plasma, I have my plasma. It will be
Different individual you.
you're your age and you've passed your illnesses. I have my age and my illnesses, and it all leaves some trace. So what if the raw material is different? Secondly, it's very different from the technical side because we have different types of tubes there to use different types of centrifuges. Different spin rates result in varied levels. YY concentrations of these factors, growth and platelets. EE also, it can be that someone will pay for a platelet-rich plasma treatment, and unfortunately it will give them no results or almost no results. Maybe someone will notice a fantastic change in themselves. Well, it's a little no, not incomparable. And as if on an even higher level, we have procedures already invasive, turns out demanding. It requires anesthesia for surgery. These include stem cell treatments and hair transplants.
Stem cells is quite such an interesting topic because it seems to be a very new thing. More because a lot of people come to me too, and more people talk about stem cells. What's this all about?
Stem cells, or more broadly, it's called regenerative medicine. This is indeed an area that has been developing extremely dynamically over the last couple of years, especially in aesthetic medicine. Just notice, for example, that when we did liposuction 15 years ago, it was the one that was taken from the belly, from the thighs, or other areas of the body. The fat was just behind the apology, thrown out and poured down the drain. Today is something.
That's it.
The closest one is this, and it's as if we first noticed that you can fill something out there with it.
Tissue strength.
So this is called lipotransfer. And a few years ago, we also noticed that it's also absolutely cool to stimulate hair follicles. There are also stem cells there. They also interact with these stem cells that we take from, for example, fat tissue. It's also a very cool procedure, for example, preparing for a hair transplant that we want to maximize. Success later hair transplantation is worthwhile to perform this type of procedure earlier.
I use it on my stomach.
Well, so be it, because there's never been a patient so thin that there's nowhere to get a little from, especially since we actually need very small amounts of this tissue for these hairy scalp treatments. If it's fat, then it's 2 syringes, really. The second stem cell procedure is We use tissue, just the skin here, as if we take it one by one. So it's such a simple mechanical process. And then we inject this cocktail of stem cells from our own head into the whole problem area. After a few months, in a typical situation, we'll have 20 to 30% increase in hair density. So this is indeed a very intense stimulus. Yeah, that's it. What's worth pointing out here, because it is, maybe I wouldn't necessarily call it a myth and not so much a false belief among some men that, well, I have this androgenetic baldness, I'm just going to wait there for another 3 or 4 years and then I'm going to get a transplant and I'm going to decay. It's not a very bad strategy, it's a bad strategy. Why? I like to talk about it in terms of numbers. So if we do a really big hair transplant, what's it going to rely on? It's going to involve, let's say, 4 up to 5,000 hairs from the occipital area we transplant to. And now let's imagine that we have a person of type 3840, a few years, with this already quite advanced androgenetic baldness, but anyway, he still has 50, 70,000 hairs on his head. If we use such a procedure to fill the stem cells with such very intense stimulation, let's assume a little bit more pessimistically, and just to make it easy to calculate, 10% is going to be an increase in hair density. The starting point is 70,000 hairs. We're going to get 110% is 7,000 new hairs, which means no, absolutely, we're not going to do this big hair transplant. Why should we waste all this stuff? Why not?
We got 5,000. I think that's a lot.
A lot of hair may seem like a lot, but it might not be enough.
Mega.
There's not much of a buttock that can be safe. 5,000, and if I did, maybe I would. He told me to break it down into 2 treatments, do 3,000 and 1,000, for example. Remember, the point is that when we transplant hair, we're transplanting it into those areas of the skin where there aren't any blood vessels ready to feed a hair follicle right away. So if we transplant too many hair follicles, there's no chance that they'll all survive, among other things. That our body won't have a chance. It won't have time to make such a large network of new blood vessels.
Built to feed the new ones.
The appearance of an onion will differ between a 25-year-old and a 55-year-old. This observation is prevalent among older individuals.
Może będzie duża skuteczność przeszczepu takiego, natomiast u osoby w bardziej zaawansowanym wieku
A very large-scale operation would simply not be a good solution.
All right, and you mentioned there earlier about helmets and those kinds of procedures. What do you think? As I understand, you have an intriguing new product to present. Could we have your assistant pass it on to us?
Thank you very much. Well, that's right. That's a helmet on a yoke. That's what it's called. And it's actually a novelty, you could say, a completely new thing that's been on the market for a few months now.
Obecne na rynku od kilku miesięcy.
A team of scientists.
Grupa naukowców.
From Germany, it's just a little bit of gel we should put on these electrodes. These are electrodes here, and we apply this, we apply it.
To są tutaj elektrody.
On the head.
No, that's it. It's not massaging here, nothing's moving here. Here, between these electrodes, an electric current just starts to flow, and as a result, the entire surface of my scalp is going to be like this. The entire surface of my scalp is going to be stimulated very intensely at that point.
Cała powierzchnia mojego skalpu będzie w tym momencie bardzo intensywnie.
What does it turn out? What did it turn out, as if from scientific research, that this kind of stimulation inhibits the aging process?
So this is for someone who can still see? He's bald and attempting to prevent it.
Absolutely, as if
What are we going to do if we can't do it anymore?
it's okay. The only solution is a hair transplant. But what if we're really dealing with this situation? Yeah, the results of this clinical trial on the effectiveness of this device are surprisingly positive because we're getting a 9% average hair growth here. We're getting a 19% hair growth here, which is an average of 13 new hairs per square centimeter. So this is really something that makes a big difference. What else is new here that is unprecedented in this industry? The device works only and exclusively in combination with a smartphone with an application which gives us two things. First of all, we can see in real time whether all the electrodes are in good contact so that if something happens, we can correct it or add a drop of gel. And the second thing is extremely important and with serious consequences. This is what we see. If whether we're peeking at someone or that person or that patient is actually regularly using this stimulation. The recommendation here is to use it every day for 30 minutes.
Therefore, some control persists like that.
The municipality, but already as if he's jumping, why the control? The results are so good that the manufacturer gives an unconditional guarantee of the result. Or actually, sorry, wrong. I said unconditionally. There is one condition. You have to use it if you use it, and if after 6 months you say you don't have any thicker hair, it's not stopping your baldness process. It's just without any further questions. The cash refunds the money. So we are happy to offer this device to all patients at Perfect Clinic, especially those after transplantation. So you can start using the device a few weeks after the transplant. It's a very safe, very cool form of stimulation.
Jeśli myślisz o zakupie urządzenia na Jostem, to świetnie się składa. Specjalnie dla widzów i słuchaczy Halo tu Marek przygotowaliśmy 5% zniżki. Wystarczy, że przy zakupie użyjesz kodu Halo Marek. Oferta dostępna na terenie Polski pod adresem her360.pl.
Besides these helmets, which are electrical biostimulation devices, we also have a range of devices utilizing light, known as phototherapy. There we have a laser comb and different types of helmets. These are also household equipment that you have to use every other day and are also very safe. This is technology available to pregnant women, to lactating women. There too, we have a very narrow list of contraindications, but you just have to note that as if the stimulation with this light is a little less intense stimulation than here, with these subtle, completely imperceptible electrical currents.
Great. I think we'll put a link or something online or something.
Just search our clinic and come with us. That
He's going to show us his book. I know. I already have the book too, and there can be somewhere effective.
her 360 baldness therapy. Yeah, that's something we're actually very pleased about, not to say proud of. 300 dozens of pages. The description of androgenic baldness therapies is just as organized as I tried to talk here a little bit, which is the pharmacological supplementation, non-invasive, completely minimally invasive surgical, and hair transplant. We have a lot of pictures here from our clinic. First of all, we show in detail what the course of this procedure is. So people who are interested can just look at what's in store for them, what they might decide to do, what the results can be expected. Oh yeah, we're trying to be educated.
It's a cool book, and I have it too, and it's in my study on YY's desk.
Mama there, Yai absolutely needed a chapter on micropigmentation, because what may not have been said here? Why enough? Why, definitely.
ludzie zajmujący się
People who
leczeniem
treat
w
baldness,
szczególności
especially
tego
androgenic
typu,
baldness,
powinni
should also
swoich
inform their
pacjentów
patients about
informować
triple
o
pigmentation or micropigmentation of the scalp as one of the solutions, and it's a solution that's hard to call therapy, but it gives us a real solution to the problem. This problem is to be defined on an aesthetic level.
Ten problem przecież jest do zdefiniowania na poziomie estetycznym.
A well-done scalp micropigmentation does its job perfectly.
On a mental level too, because I see, for example, how it changes, what a mental transformation is. People are also in our treatments because you can see that a person is healing. Besides, young people who are affected by the problem of baldness often come to me and are already starting to, so to speak, mentally decline a little. Of course, we also recommend trichology, different treatments or mesotherapy, different paths to just try other things first, not micropigmentation right away, because for me it's a little bit like that. Maybe a last resort because it's worth a try. Other therapies, as long as there is still hair, for example, for me, if there is no more hair, then I guess nothing can be done, and then micropigmentation.
Absolutely, as if it weren't. These situations can be very different. So here I think there's no point in entering into any kind of dialogue in this direction. But one more thing I'd like to emphasize is that just as on the strict biological side, hair is not necessary for us to live. So it's not an organ like the liver or the kidneys or the lungs, but they have an extremely strong connection to our psyche and our well-being.
And that is precisely what we are observing in a baldness treatment center. We had to rapidly enhance our skills in the field of psychology. My partner is a certified trauma surgeon, and one of the main reasons is the frequent occurrence of patients whom we also assist with the psychological dimensions of psychotherapy. On one end of the spectrum are individuals
with dysmorphophobia, which is someone who objectively wants to say that everything is okay.
Thank you.
They constantly think something is wrong, they feel uneasy, and that is the conclusion. And at the other end of the scale, we have a situation where people, for example, get depressed precisely because they're losing their hair. And here we can both talk about young men with androgenetic alopecia or
children, adolescents, and young adults with pustules, they exhibit these symptoms.
Two examples of areas that have a very strong impact on the psyche.
A lot is influenced by this single factor. Self-acceptance, yes, because I also often have patients, and at the beginning it is, and that there is a problem, hair falling out. We will do micropigmentation of the scalp, and then you come in a couple of weeks, and I say, damn, well, it's actually cool because I don't have to wash this hair and style it and worry too much. For example, in the winter, the hat is put on and ready to go, so that, well, it's actually something there. Self-acceptance.
You possess an additional benefit in your toolkit that, unfortunately, the medical field here lacks. In the context of hair, you can count on a quick result.
Yes, because it's practically visible right away, except for a little redness, but that's it.
I'll estimate roughly a dozen days, but the process is complete. All the ointment therapy, hair therapy, it's always months, especially as if in this slow process of genetic baldness, let's say that platelet pattern baldness can sometimes respond a little bit faster to some effective therapy, but here it always happens slowly. It's always postponed at this time. The result and the satisfaction?
All right, wonderful. I believe we've thoroughly covered today's topic. Could you remind me where you can be found?
I'm thinking something.
That we will also display the question.
If we're talking about
in the physical realm, you'll locate us in Katowice at Fabryczna 15B on the 4th floor of the Perfect Clinique. As for the online presence, you can visit either Perfect Hair Clinic PL or Alopecia.pl.
Great, thank you very much and welcome to the next issue in a month.
Thank you very much.
Jeśli myślisz o zakupie urządzenia na Jostem, to świetnie się składa. Specjalnie dla widzów i słuchaczy Halo, tu Marek przygotowaliśmy 5% zniżki. Wystarczy, że przy zakupie użyjesz kodu Halo Marek. Oferta dostępna na terenie Polski pod adresem her360.pl.